And you all notice they're thoroughly randomized. Yes? Totally randomized. And give them another shuffle. We're just going to spread them out. And if it's okay, may I ask you to slide out any card you want. Now, we won't look at the face yet, but I'm going to have you just slide out any card you want.
Kind of stuck.
Ah, thanks, very good. Would you agree that that was a random selection,
Yeah.
a fair selection? You just selected a card at random. And now I will turn my back, and I'm going to ask you, please, to turn the card over, sign the face of it with your name or any identifying mark you want, and then to turn it face down again. Okay? And when you're ready, just tell me, and I'll turn back around.
Okay, I'm ready.
Very good. Now, I am going to ask you, if you will, to take your card and to set it here to the center of the deck. Very good. Card has been randomly selected. Randomized is fine. Put to the center of the deck. Mixed back into the deck. My task now is I am going to select a random card, and I am just going to randomly select a card, and I have randomly selected a card. And I can tell when you look at that card that you're not overwhelmed. I can tell you're not even whelmed. I have here a plastic folder through which I can see you, and through which I can see each of you, and you all can see me. And now, I am going to take the card that I selected at random and slip it into the folder. So we have one card, and only one card inside that folder. In many ways, this represents, when patients present to us, they come to us as if from a shuffled deck, randomized, and our goal is to take signs and symptoms and to come up with an accurate diagnosis, and then to intervene and treat. And in so doing, we don't want to commit an error, either an error in fact or an error in judgment. We don't want to engage in an omission or a commission. Certainly, we don't want to engage in negligent practice. So I want you to watch closely, because the magic will happen before your very eyes. One and only one card is inside this plastic folder. And I can tell when you look at it, you are not overwhelmed, because this is not matched your card, a card that in fact you signed. And so we want to be certain that we meet the patient's needs. So I want you to watch very closely, because this will happen in the blink of an eye. So please do not blink yet, because that fast you see things change, just that quickly. And there is one and only one card inside that plastic folder, and that one and only one card is your card. Thank you all very, very much.